It's the Happy Families podcast. It's the podcast for the time-poor parent who just wants answers now.
Today, a very serious conversation on the Happy Families podcast, probably a conversation that doesn't have much to do with happy families. In fact, it's the kind of thing that can be tremendously challenging. Just a warning before we dive into the content today, this is definitely not content that is going to be what you might call typically safe for children, especially younger children. We are going to be talking about findings from the Australian Child Maltreatment Study and a conversation about abuse, specifically sexual abuse of children. So please be mindful that that's what the content will be, and be judicious and use your discernment in terms of whether or not you or your children will do well by listening to it. But my goodness, it's important. My guest on the podcast today is Dr. Ben Mathews. He's a research professor in the School of Law at QUT, the Queensland University of Technology, here in Brisbane, Queensland, Australia. Also the Principal Research Fellow in the QUT Faculty of Business and Law, and an adjunct professor at Johns Hopkins University, Bloomberg School of Public Health. Dr. Mathews was a professorial fellow to the Royal Commission into Institutional Responses to Child Sexual Abuse. He's published 3 books, 20 government reports, 125 refereed scholarly articles and book chapters, and 50 law reform submissions on issues concerning children and the law, and over 100 national and international conference presentations. And he works on the Australian Child Maltreatment Study. Dr. Mathews, it's really a privilege to have you on the podcast to talk about a topic that is sordid and unfortunate and yet so important. Really appreciate you joining me now.
Thanks, Justin. Great to be with you, and greetings to all your listeners. This is a really important topic. And look, this is actually about happy families, and I'll explain a bit more about why that's so. So it's good to be contributing to a podcast for your organisation.
Ben, let's set the stage. The name of the study, the Australian Child Maltreatment Study, what's it actually all about? Can you give us some detail?
Yeah, so this was a massive study that we conducted over the last 5 years. So I led a team of 10 chief investigators. Basically, it was a very, very broad and comprehensive study, the biggest and most rigorous of its type in Australia and significant globally. Basically, what we did is we surveyed 8,500 Australians aged 16 and over to establish for the first time the true prevalence within the population across Australia of all 5 types of child maltreatment. So we measured sexual abuse, physical abuse, emotional abuse, neglect, and exposure to domestic violence in childhood, and those experiences right across the span of childhood, so right up to age 18. So in other words, in short, we found out the true percentage of kids who experience those types of forms of maltreatment. We then identified information about the nature of those experiences. So, for example, who is it, who inflicts it, the age at which it starts, and so on. Importantly, we then measured the associated health outcomes of those experiences, especially mental health outcomes and health risk behaviours, things like self-harm, suicide attempt, and drug dependence. So, in other words, we found the extent of child maltreatment in Australia. We found differences in how it affects girls and boys. We found whether trends have increased or decreased over time in Australian society, and we found out which types of maltreatment are particularly damaging for health.
I feel like, as you described that, Ben, we could probably do a 10-part podcast series on all of the research findings that have come out of this study. Obviously so important. The one that I want to focus on today, and it's only one, unfortunately, I wish we could do them all, is a finding from the study that looked at sexual abuse and specifically who is most likely to be an abuser. This is something that just everything in me, I don't know if panicked is the right word. That's probably a little bit too alarmist, but certainly it was just shocking. Can you talk me through your findings around this specific area, please? Because it's the kind of thing that I think every parent needs to know.
Absolutely. And look, everyone does need to know this. These are really, really important findings. In terms of child sexual abuse, we found a prevalence across the population of 28.5%. So a significant proportion of the population have experienced sexual abuse in childhood.
It's a stunning number, a quarter, more than a quarter of kids.
So slightly more than 1 in 4.
Okay, let's talk about who's doing it, who's most at risk. Can we step through what you found there?
The first thing I want to say is that there has been a decline a slight decline in sexual abuse in recent years. So one of the great things our study enabled us to do is by looking at prevalence rates in different age groups in our study, we're able to see, has the rate of sexual abuse in the population increased, decreased, or stayed about the same? And if so, have trends varied by different kind of perpetrator group? So the first, good thing to report is that yes, sexual abuse has in fact declined, and we know that from comparing the rate from our 16 to 24-year-olds in our sample with those who were aged 25 to 44 and those who are aged 45 and above, right through to 65 plus. So there's some good news there, and that shows us that some of the prevention efforts that we've implemented as a country have been having a good positive effect in reducing child sexual abuse. So that is fantastic news. It shows that change is possible and change continues to be required. So the first thing we also need to say is that sexual abuse is still a problem. So even within the 16 to 24-year age group, which is who I'll talk about most today, we have 25.7% prevalence, and it's particularly affecting girls rather than boys. So about 35% of girls and young women in our 16 to 24-year group experienced sexual abuse before they turned 18 versus, say, 14% of boys and young men.
And when you say they experienced it, it didn't necessarily have to be when they were a teenager. Okay, so this is retrospective, right? It might have been when they were 4, 5, 8, 12.
Exactly. What we then did, Justin, and this is what I think you're really interested in today, is who is it who inflicted those acts of sexual abuse? So we asked 4 questions about sexual abuse, and for each one of those questions where someone said, yes, that happened to me, we asked who was it who did it. And so this enabled us to identify which perpetrators have inflicted sexual abuse at different rates across time in Australian society.
So as a parent of 6 daughters, for me to keep my kids safe, I need to know what to teach them. And obviously part of this is the conversations that I have with them about their own safety and protection, but it's also helping them to stay away from places where they could be at increased risk. Who did you find were the kinds of people who would put children at increased risk?
Well, look, it's a complex and nuanced picture, so I'm glad we've got a good amount of time to talk about this today. And it's important not to overgeneralize or oversimplify. The first thing I want to say is that sexual abuse by adult perpetrators, even in the younger generation that we surveyed, is still a significant problem. Okay, so we found 11.7% of our 16 to 24-year-old sample. We can extrapolate that across the nation because we had a nationally representative sample in our survey. 11.7%, so 1 in 8, experienced sexual abuse by an adult perpetrator. Okay, so in other words, if you went into any average year 12 classroom in Australia that has, say, 32 kids in that year 12 classroom, 4 of them will have experienced sexual abuse by an adult perpetrator, okay? And I'll come back to how we measured sexual abuse in a moment so you know the kinds of acts that we looked at. But we did also find that within our 16 to 24-year-olds, we had a rate of 18.2% who experienced sexual abuse by another adolescent. That is another kid aged under 18. Okay, so 18%, so close to 1 in 5 of kids in contemporary Australia have experienced at least one sexually abusive act by another adolescent aged under 18. And when we looked a little bit further at that, we find that most of those adolescent perpetrators are other kids that the child knew.
Okay, question for you around that. How do you distinguish between what I might generously call adolescent experimentation and sexual abuse?
That's a great question.
I don't want to minimize the impact that can have. It can still be abusive, but there are kids younger kids play doctors and nurses, and we discourage that, but we also recognize that they're kids and they're just sort of learning about their bodies. Where do you draw the line on that? Absolutely.
Very important question. This is all about the proper definition of what is child sexual abuse and what is not. And what is, in your terms, say, adolescent experimentation, and you referred to, say, young kids playing doctors and nurses. And look, I would say, a lot of people probably don't discourage that. And that's probably okay, because that's a developmentally normative thing for very young kids to do. It's about learning about their bodies. There's no problem with that. That is not child sexual abuse. So some things that we call adolescent experimentation or early childhood experimentation, for want of a better term, adolescent experimentation that is developmentally normal, natural, common and typical in childhood and adolescence, involves consensual acts between similarly aged peers.
Yeah, so there's no coercion, there's no power imbalance.
No coercion, no pressure, no clear power imbalance.
Right.
Okay? Consent is key. Consent is key.
In fact, a funny story before you go on. We caught our kids with their cousins. They were doing they weren't actually doing doctors and nurses. They were doing a shopping trip. But when they were paying for the groceries, one of the kids had pulled their pants down and they were using their bum crack as the credit card slot. And they found my mum's credit cards and they were sliding the credit cards down the bum crack. And of course, this is not child abuse. This is just fun kid experimentation that we still put a stop to and explain why. You don't want to get your credit card dirty, right? But but obviously there's a distinct difference, and the one that you're drawing the line under most clearly here is consensual.
Exactly. And so I'll just give a little background here. There's been a lot of dispute, even amongst the scientific field for decades, about how do we properly define what child sexual abuse is and is not. And it's really important to do that very well, because it has huge implications, say, for epidemiological studies like ours about what you count and what you don't. But it's also got implications for legal fields, for policy and prevention practice, for education of kids, and so on. Before our study commenced, I and a colleague of mine from overseas spent about 3 years doing a really systematic review and analysis, and came up with a model, a conceptual model of what child sexual abuse is. And that has really helped to advance the field. And I'll just give you the conceptual model or definition that we came up with, and then explain what we measured in our study, just so we know what we're talking about here. So basically, based on our systematic review and analysis, and this was published in the leading journal in the world, we define sexual abuse as a sexual act, and this model has a number of components. I'll just take you through them. So a sexual act, it can include physical contact, but it can also involve a non-contact act by any adult or child. So sexual abuse can be inflicted by another, say, adolescent aged under 18, who's in a position of any kind of power over the child victim. It could be physical power, could be psychological, something relational, to obtain sexual gratification. Okay, and that's an important point. When the child victim either doesn't have any capacity to consent to sex, so let's say they're really little, or they technically have capacity, that is cognitive capacity, let's say they're 16, 17, but they did not actually provide consent. So there's a few different components to that model, all of which are important and go into a model of what child sexual abuse is, and helps to exclude other things like developmentally normal play from that definition. And to round off this comment, Justin, to explain how that then translates to operational definitions of sexual abuse and the things that we measured in our study, it includes things like forced sexual intercourse, whether vaginal, oral or anal. It includes attempted forced sexual intercourse, forced sexual touching. There are 3 contact types of sexual abuse, and then non-contact sexual acts. So, for example, forcing a child to look at someone else's private parts, or forcibly looking at a child's private parts.
It leaves me feeling a little queasy and very uneasy, but I'm thinking about practical terms now. So I've heard far too many stories about kids who have been harmed by the adolescent boy up the road, or the big brother, or the big cousin, or they've gone to somebody's house and there's been a visitor there. These stories are prolific. I'm sure that you've heard far more of them than I have. What does this mean in practical terms for families who let their kids play in the street or the park down the road or at someone's house just up the road? What does a parent do here? Because we can't help all of them.
Good question. But a couple of things to note. First is that it's important to be aware of who is more likely to be a sexually abusive perpetrator against kids and who is not. So we now know that, stranger danger, that's an old dated myth. It's not that unknown people never sexually abuse kids, but in the big picture, it's much more rare for unknown people to abuse kids than known people.
Minuscule percentage.
Exactly. And so translating this to our study and to young kids today and to parents today, it's good to know who your kids are socialising with. And part of knowing who your kids socialise with is to talk to them and listen to them and show an ongoing interest in their lives and to know about what's going on in their lives. It's also important to develop sufficiently close relationships with your kids that you have conversations about sex and relationships and about knowing about consent and about knowing about gender equality, about knowing what's okay for other people to do to your kids, but also what's okay and not okay for your kids to do to other kids. So having that broad relational connection with your kids and creating space where you have healthy conversations about sex and development and relationships and all the skills and attributes that go towards healthy human beings and healthy relationships are strong protective factors. One other thing, just before I round off that comment, Justin, as well as knowing who your kids are socialising with, it can be helpful, especially in kind of riskier situations, let's say parties where 15, 16, 17-year-olds are gathering and clustering. It's helpful to have appropriate supervision, especially if there might be, say, alcohol involved.
I was speaking with Dr Ben Mathews. He's a research professor in the School of Law at Queensland University of Technology and also the lead researcher on the Australian Child Maltreatment Study. When I'm listening to what you're saying here, Ben, I'm really concerned. I mean, we've got 1 in 5 kids. These numbers are big. These numbers are really substantial. But I don't want to tar all teenage boys, for example, with the label of potential child abuser, potential molester. Having said that, given that the most common perpetrators of child sex abuse in Australia are other under 18 individuals who are known to the victims, what do you think the factors are that are contributing to this offending? Why is it that adolescents are, I don't know if it's increasingly likely, we didn't mention the trend here, but why are adolescents so likely to offend sexually, particularly against their same age peers or those who are younger than them?
Yeah, a couple of prefatory comments I'll give there. We did find that there has been an increase in recent years in offending by other adolescents aged under 18. That's true. And we did find that rate of, say, 18% of our 16 to 24-year-old group had experienced sexual abuse by another adolescent. Okay, so about 1 in 5 had experienced that. The flip side of it, which is, a stark story, but it's one that we all need to know. The flip side of that is that 4 in 5 had not experienced sexual abuse by another adolescent aged under 18. Okay, so we don't want to demonise all adolescents. Absolutely, that is not the message. And we don't want to demonise all male adolescents either. That's not the message. At the same time, when we look at the group of adolescents who did sexually offend, or based on our self-report study by the victims, who had experienced sexual abuse by other adolescents, the majority were male adolescents known to the child victim. Okay? And most of them had not either currently been the victim's boyfriend or had previously been the victim's boyfriend, but they were known to them.
Okay, so this is a non-romantic relationship. It's not like
Exactly.
they're in a relationship where there's some level of coercion. This is we know each other and suddenly somebody is a victim of abuse.
Exactly. Although we also did find an increase in sexual abuse of kids aged under 18 by others under 18 who were current boyfriends or former boyfriends as well. Okay. So we did find a little increase there too.
So I guess the question is why? In both cases, why?
And this is a really difficult question to answer. We did consider this as a team when we conducted our analysis and wrote about it in the journal article. And it's difficult to be sure of the precise reasons for this increase, but we did consider this and came up with a couple that we thought were likely, but we would really need further research on this. But one reason we identified is that there may be a perceived heightened societal pressure to have sexual experiences due to a generalised sexualisation of adolescents, especially as expressed in media and social media these days. So one thing that has clearly demarcated the current generation of adolescents compared to, say, those around, say, 20 years ago and 40 years ago is that we have this proliferation of social media, which can heighten social expectations and various perceptions, for example.
Right, so you see and hear about what all the cool kids are doing or what all the influencers are doing, and you see what's happening in the movies. And obviously, I want to talk to you about pornography separately, but
yes,
you've got all this kind of hyped up sexualization that adolescents are swimming in.
Exactly. And also depictions of masculinity or perceived masculinity and perceived successful masculinity and perceived strength. Okay, so we have certain kind of gender norms that can be portrayed in social media as well that might be even more pervasive and kind of powerful in conveying these messages, which are obviously often inaccurate messages, but can still be influential on developing teenage minds. You also mentioned the influence or potential influence of pornography, and we gave this strong consideration as well. Now, there's a lot of mixed scientific evidence about the impact of exposure to pornography on sexual violence, but it seems that the better evidence or the best available evidence indicates that it's not necessarily exposure to any pornography or any explicit content that affects violent sexual behaviour, but there is better evidence that exposure to violent pornography or explicit violent offending can have an effect. So we do think, or we would suspect, that it's plausible that the heightened availability and access to online violent pornography may have had an impact on this increase in adolescent offending in recent years too. And that's partly to do with the creation of gendered norms, expectations, senses of sexual entitlement, a feeling or a lack of respect for girls and young women, and a lack of gender equality generally. Those types of attitudes and dispositions we know are likely to increase sexually aggressive behaviour. In contrast, things like a lack of a sense of sexual entitlement, empathy towards others, impulse control, these are the types of things, respect, empathy, gender equality, that really matter in producing healthy human beings and people who don't inflict violence and sexual violence on others.
Ben, I want to take this conversation in a slightly different direction. Well, actually, I want to stick with the pornography side of things for just a moment. It's such a provocative and rightly well-discussed area. Last year, towards the end of the year, the Australian federal government vetoed submissions from the Safety Commissioner, Julian McGrant, to develop an age verification system for explicit online content. In other words, a way of really making sure that access to explicit content online, pornographic content online, is only available for people who are 18 plus or very savvy teenagers who have done a workaround, but they're going to have to work really hard to get there. To what extent do you think that having this kind of government intervention, had the government said yes to it, what might that age verification system do in terms of being helpful in reducing the kind of abuse that you've been studying?
Look, Justin, this is a great question in a very complex area. And it's tough to be definitive about this because so much depends on what are the exact parameters we're talking about here. How do you define explicit material? Which specific types are you planning on applying this age verification threshold for? What I just referred to earlier is the best evidence in the field indicates that certain types of violent pornography can tend to have an impact on behaviour and attitudes. But exposure to other types of explicit material may not, or there's no sufficient or compelling evidence to indicate that it does.
Yeah, and I guess you've also got issues of causation, right? So people who are more likely to be offenders then going to seek out that material. So therefore, is it a personality attribute, or is it the content that they've been consuming? It's really hard to do ethical studies with teenagers around.
Of course, there's also that sequencing, that temporal sequencing issue and issues of correlation, causation, etc. What I would think is much more important, though, is to accelerate public health efforts about healthy sexual relationships and education of kids in schools, and supporting parents to implement healthy sexual relationships education of their own kids in the home, so that we have a parallel approach to this to help our kids develop healthy sexual and healthy relational boundaries and attributes within themselves. That would be much more important, much more effective in continuing to, or in arresting this increase in adolescent sexual offending and in decreasing it in future generations. That's what's most important.
Yeah, the Chanel Contos teacher's consent type of
Exactly.
intervention at home and at school, a dual approach. Okay.
Exactly.
Well, I guess that feeds into my final question. This is a podcast that's typically designed for the time-poor parent who just wants answers now. We've obviously gone a lot deeper on a very sensitive topic today than we usually do in this podcast. But I'd love to get really practical in wrapping things up. This is a conversation that's obviously vital to our children's safety and their health and their well-being. If you were to outline the three most important things that you think parents should do with this knowledge, what would they be?
This is the million-dollar question, isn't it? But the first thing I would say is that the best thing we can do as a society, and the best thing parents can do, is to help develop in your kids the skills and dispositions that promote healthy sexual development and healthy sexual behaviour towards themselves and others, and that minimise the attributes that contribute to sexual violence. This applies especially to boys, but also to girls. So one of the things that parents can best do is to educate their kids about their bodies, about sex, about healthy sexual development, healthy relationships with others and themselves, and about gender equality. A second thing I would say is to develop relationships with your kids so that you can have ongoing conversations, open conversations about sex and relationships, and not silence this, not leave kids to their own devices, and not having good modeled behaviour and receiving good messages. And the third thing I think is that it's really important to help kids, and especially boys, to develop empathy towards others and understanding that they're not entitled ever to sex with others, that sex should only ever happen with full consent, and that it's a healthy, normal, natural part of life that can be engaged in and enjoyed under the right circumstances. All of those things together will provide us with a lot of good messages and hopefully help to produce, good young people moving forward.
My definition of consent at a practical level when I'm talking to my kids or adolescents generally is, if we're both excited about it, then it's probably going to be okay. But if there's anyone who's not excited about it, we could have a problem, because you wake up the next day and there's regret and pain and so on, and suddenly it doesn't feel quite so consensual. Dr. Ben Mathews is a research professor in the School of Law at Queensland University of Technology in Brisbane, and also the lead researcher on the Australian Child Maltreatment Study. Ben, such a vitally important conversation. Thank you so much for being so generous with your time. I know it's been really challenging to squeeze this in, but it was such an important discussion, and really appreciate you joining me.
Thanks, Justin. My pleasure. Happy to talk another time.
The Happy Families podcast is produced audio by Justin Rulon, video by Jet Hatchard. Our executive producer is Craig Bruce. If this has sparked anything for you and you or your family need help, please speak to a mental health professional, or at least go and see your GP and get some advice on next steps. Sometimes you may even need to speak to law enforcement depending on the circumstances. So please be discerning in who you speak to, but get the help that you need. Hopefully we can talk to Ben again about some more findings from the Australian Child Maltreatment Study. It's such an important topic. For now, though, thank you so much for watching. Thank you so much for listening. And if you'd like more information about what we've talked about, check out the Australian Child Maltreatment Study online or visit happyfamilies.com.au.